Is it true that taking clonazepam that you will always take it, even if given for 1 year at zero point 0.5? No, this is not true. This is a lie. It Okay, any benzodiazepine, um, it doesn't mean that you have to always take it. Now, I'm going to back up and say that some patients, seizure disorders, for instance, okay, may need to be on benzodiazepines long term, though there are safer treatments out there that require no medications for seizure disorders, like vagus nerve stimulating device, um, that you could do. Some patients will be told this because of that, and in that regards, then yeah. Um, some patients have a debilitating panic disorder, though even for panic disorder, it's stated, short term, while the person is in therapy. Therapy is first line treatment for panic disorder, PTSD, okay, type of symptoms, and anxiety. Benzodiazepines are never to be used. Clinical guidelines state this long term for just anxiety. Okay, so if that's the reason you're taking it, and you want to come off of it, then you have to do it very safely. Now, what tends to happen when someone is on it for a year or more is you become dependent on it, not that you're addicted to it. And the reason I differentiate addiction from dependence, and some people in the comments that I get in these videos, oh, it's still addiction if you're hooked on it. No, because addiction is something completely different. And we have to differentiate the two, especially because of the stigma of addiction. Drug addiction, you're looking, you'll rob someone to get your next hit of if you're hooked on Klonopin in an addictive way. Okay, because some people snort and sniff Xanax, Klonopin, Ativans, etc., because they're addicted, and they will go through great lengths to get their next fix. Okay, that is different than someone who's prescribed a medication that caused dependence because of long-term use. Dependence is a physical dependence. You try to start coming off of the medication, and now you start feeling super shaky. You start having panic attacks. You start having tremors, insomnia, all of these rebound symptoms start occurring. And then your doctor tells you, well, it's just your anxiety coming back. You have to be on this for long term. No, what's happened is that you've ended up in this tolerance and dependence, and what they are going to want to do is increase the dose to keep you in that stage of tolerance or dependence. But you have a choice to come off if you choose to do so. Okay. And that's the other thing, is that you always have a choice, and you have to weigh out the risks versus the benefits. If you are struggling to come off of this small of a dose of 0.5 milligrams, I would recommend getting it in liquid form and doing very small, like 0.01 decreases of the medication every like 4 to 6 weeks, and coming off of it very slowly, or switching, if you can tolerate, the switch to diazepam. Switching to diazepam, because diazepam is long term. This is the Ashton manual way, okay, for those of you who understand this space. Switching to diazepam, because it has a longer half-life, you're not going to have the issue with interdosing withdrawal, which happens when you try to cut back clonazepam. Oftentimes it needs to be spread out into 2 or 3 doses to avoid interdosing withdrawal, where diazepam, because it has a long half-life, it's just 1 dose that you would take at night because it's more sedating, and then it's going to have the lasting effects during the day, and then you could decrease from there, and then you would do like a 10 milligram diazepam, and then start by reducing by 1 milligram. By the time you get to 5, reduce by 0.5 milligrams, and you could do liquid once you get to that point. You liquid diazepam. And the other thing about diazepam, and the reason why Heather Ashton used diazepam, not only because it has the longest half-life is also because it's available in liquid form. A lot of patients have a hard time getting their medication like clonazepam or Xanax compounded into liquid form. Or it can be also be compounded into lozenges if you prefer. It's like compounded into anything that is less than like a zero point 0.5. So that's your options if you want to come off. But I always tell people that you have to look at as far as the risk versus benefit, right? And your reasoning behind it. Why do you want to come off of it? Do you feel you're at a place that you want to come off of it? Have you been doing therapy and doing really well with managing your external stressors, dealing with your day-to-day anxiety? Because guess what? Anxiety you don't get rid of. Okay. I know we've pathologized, I guess is the word, anxiety. However, anxiety is part of the normal spectrum of emotions, and it's something that is essential for our survival. So you're never going to get rid of anxiety. It's about how you manage it, and is the anxiety debilitating or not? So I think it's very important that when you're considering coming off of your benzodiazepine, that you ask yourself, why am I doing this? That number one, and that this is your decision, not the doctor's decision, not the your boyfriend or husband's decision. This is your personal decision. Then number two, am I at a place where I can manage my anxiety, or is my anxiety still a mess? If your anxiety isn't being managed well, you're not managing your external life stressors, if you're still having panic attacks, get that under control, start managing that. Then when you're at a place of stability, then again, go back to asking your question, like, why do I want to stop this? And am I ready to stop it? Okay. Some people want to stop it because they're experiencing adverse effects. Some people want to stop it because they have the long-term issues, like the cognitive issues, the imbalance issues. Some people want to stop it because they want to have a child and they don't want to be on medication, right? So there's a lot of reasons to want to stop it, but you want to make sure you're at a stable place mentally as you go through this process, because it's going to challenge you when you start tapering. Even when you go slow, okay? When you go slow, you're helping to reduce the major things that can happen with withdrawals and the intolerable withdrawals. Those symptoms tend to be shortened and less going slow, but it's not unavoidable. So you want to make sure you have a lot of tools in your toolbox to be able to manage that anxiety that can occur and arise during the withdrawal.